I'm Dr. Daria, and what do you do if your child aged 3 months to 12 months has a fever? Now, fevers in children are a standard fact of life for any parent. I had just gone to the office the other day when my daughter's school called saying she had a fever and wasn't acting right, so I hightailed it home to go check on her. But first of all, what is a fever? A fever is defined as a temperature of 100.4 or higher. The most common causes in kids are viral infections, but they can include bacterial infections like strep throat, ear infections, and others. So here are 3 things I want you to do if your child has a fever. Number 1 is to look for the red flag signs. Now these are signs that mean you should call your pediatrician, or depending on how severe they are, even potentially go to the emergency department. Those include if your child has a temperature greater than 102.5. If they've had a temperature higher than 24 hours, then you definitely need to go talk to your pediatrician. If they're really fussy, have a new rash, if they're having a lot of diarrhea or vomiting, or if they're refusing to drink fluids, especially after a few hours, or if they just don't seem right or are lethargic. Pay attention to that parent gut. I found it as an ER doctor. That parent gut is really good and knows your child very well. Number 2, if your child doesn't have any of those red flag symptoms, then you can do some things at home. Number 1 of that is encouraging them to drink plenty of fluids. If you're nursing, go ahead and nurse. Give them formula if you're giving them formula, and after the age of 6 months, offer them some sips of water. Make sure you don't overdress them. And if you want to, you can consider giving a sponge bath, although if your child's really febrile and cold, it may make them feel worse. Of course, there are some old traditions to give alcohol baths, and you never, ever want to give an alcohol bath. Number 3 is if your child just seems really miserable from the fever, you may want to give them some medications to bring down the temperature. Those include acetaminophen or Tylenol. If they're older than 6 months, you can give them ibuprofen, otherwise known as Motrin or Advil. But remember, never give aspirin to anyone under the age of 18. As far as my daughter goes, I came home, I checked on her, checked her ears and her throat, gave her some medication to feel better, and figured it was probably viral, and that I'd come down with the same thing in just a few days. But follow these 3 tips, and you as a parent will always know what to do when your child has a fever.